Welcome back to the Best PT Podcast. This is episode 4.10, talking about pulmonary procedures. Starting with airway adjuncts. The purpose here is to maintain or protect the airway in order to promote airway clearance or begin the process of mechanical ventilation. So an oral pharyngeal airway is a plastic tube that fits along the palate and tongue. A nasal pharyngeal airway is a plastic tube inserted through the nose into the pharynx. An endotracheal tube is a plastic tube inserted into the trachea from the nose or mouth. And finally, a tracheostomy tube is an artificial airway that's opened via an incision below the vocal cords along the throat. There's airway suctioning. Lobectomy is when one or more large air spaces called bullae form after alveoli are destroyed by emphysema. So a lobectomy is the surgical removal of these bullae. A lobectomy is the surgical removal of part of a lung lobe or a whole lobe. Lung transplants are used with end-stage COPD, interstitial pulmonary fibrosis, and cystic fibrosis. A lung volume reduction surgery is the removal of lung tissue damaged by emphysema. Mechanical ventilation and oxygen therapy. We also have a thoracotomy, which is the opening of a chest wall to access the heart, lungs, esophagus, or diaphragm for diagnostic or treatment purposes. These incisions can be axillary, sternal, posterolateral, or anterolateral. And then finally, a tracheostomy is that process of creating a tracheal airway for a tracheostomy tube with the purpose of beginning mechanical ventilation. That was a short one. That's it for episode 4.10, Pulmonary Procedures. The next episode, 4.11, we'll talk about physical therapy, tests, and measures for the cardiopulmonary system. As always, the outline will be in the show notes. Thanks for joining me.